Gentlemen, we start teaching you the handshake technique because it is equally efficient for teenagers and adults. But we do not want you to use it on youngsters below the age of, 10, 12, well, I would say around teenage. Figure to yourself that it's not so good. You might say to yourself, well, why is it that we start you with a handshake technique, have you practice with it for 2 weeks, and then immediately have you go on to something else? I don't want you to be like the doctor who, at the end of the second session, came to my wife and said, just when I was getting so good with the handshake technique, your husband tells me to forget it and start with something else again. That's not our idea at all. I never teach you anything that I want you to forget. But I teach you the handshake technique because the handshake technique enables you to learn things about hypnosis that you would learn with no other technique in starting the study of this subject. For example, the first thing that the handshake technique teaches you is that rapport can be gained instantly with a patient. A hand clasp is the age-old symbol of friendship, so that when you shake hands with a person, that person can't believe that you're going to stab them in the back. You're just shaking hands with them. That increases rapport. But in reality, the handshake technique enables you to be one step ahead of your patient at all times. For connected with that handshake is one of the first signs, in fact, the very first sign of hypnosis. Now, what do I mean by hypnotic signs? Hypnosis gives off signs, 6 of them. 6 signs which can't be aped, copied, pretended, or acted. Now, since you cannot ape or pretend these signs, they must be there. They must definitely be there, and you can't act them out. They have to be there, and they are observable. What do you suppose that first sign is that you can find by just shaking hands with a person? Did that occur to anybody, that why I had you shake hands with people? Must be a reason, because I don't teach anything except for a reason. Did any of you discover the reason for the handshake? Well, let me tell you this, gentlemen. Body warmth is the very first sign of hypnosis. And I'll venture to say that several of you noticed this week, or these past 2 weeks, that when you finished working with a patient, sometimes they would rub their hands and say, oh, I feel so warm. And sometimes they would take out their handkerchief and say, oh, I feel so warm. Or words to that effect. How many of you found that people called your attention to the fact that they were warmer than normal? Warmer than ordinary, let me say it that way. You found that. Did none of the others have that experience? Well, let me tell you this. Body warmth is such a sign of hypnosis that as you work deeper with hypnosis, you will be able to observe that the cooler a person is, the less they respond to suggestion. And the warmer they are, the more they respond to suggestion. For example, if you clasp the hand of somebody whose hand is cold and dry, since body warmth is a sign of hypnosis, you know instantly that that person is cold to the subject of suggestion, and you probably would not be very successful with him or her. However, suppose you clasp the hand of someone whose hand was hot and wet. This would probably say to you, this person is an anxiety neurotic. And an anxiety neurotic is infested with inner conflict, in which case hypnosis becomes a contest. You can't afford a contest in hypnosis because hypnosis is a consent state. Certainly a contest does not betoken consent, and you would probably not succeed with a person whose hand was hot and wet. You wouldn't succeed very likely with a person who's hot and wet, nor the person whose hand is cold and dry. Everyone in between is in the norm, however. You should be able to be successful with everyone else. Now, the reason we don't tell you about the cold hand at the first session, nor the hot, wet hand, is the fact that when we did tell the doctors that, I would notice on their papers, failure, didn't try, hand was cold. Well, I'd say, oh, no, I want them to try. So we now withhold that information until the second session so that you can get a chance to work with the people whose hands are cold and have some failures, if failure it is. On the other hand, there are enough exceptions to the rule so that this does not always apply. And you might shake the hand of a person and find it cold and find them quite amenable to suggestion. In which case, I would just be depriving you of a success if I warned you not to try a cold hand. But as you know hypnosis better and better, you will begin to realize that since body warmth is a sign of hypnosis, that the more normal temperature the person has, the more likely you are to succeed with it. Now, there are 5 other signs of hypnosis. What did you see as you practiced this week? What did you see in the way of signs that could not be acted, could not be pretended, could not be aped? They just had to be there. Nobody could act them out. What did you see that was different? Did you see anything? Eye flutter, definitely. Definitely is a sign of hypnosis, and it is the second sign of hypnosis, fortunately, because when he said that, that is the second sign of hypnosis. When I shake hands with somebody, I feel the hand and I say, this person is amenable to suggestion, probably. Then when I get the eye flutter, I say, they're on their way. Now, you have mentioned 2 signs. How many of you saw the eye flutter? Notice the number that saw eye flutter this week. But there are several other signs. What else did you see? Any other signs that you noticed? Did you notice anything else?
A couple of them, they were almost crying.
Ah, yes, that's another sign. No, that's not a sign. Anybody could act sleepy, but you can't act tears, doctor. The increased lacrimation. Increased lacrimation is something that you will always notice. You will never be able to hypnotize anybody who does not show increased lacrimation. If you hypnotize, you get increased lacrimation. Sometimes I think it is because that in this utter relaxation which the patient gets in hypnosis, the muscles guarding the tear ducts are so relaxed that, well, lacrimation just seems to increase. Now, not knowing anatomy, like you people know it, I can be completely mistaken in my belief that this is the cause. But I have never found an explanation, and no one has ever explained to me satisfactorily why those eyes tear like that. Sometimes you will find the patient's eyes will tear copiously, yet they will not be crying. Sometimes they'll think they're crying, and because they think they're crying, they'll start crying. You particularly find this with little kids whose eyes have a tendency to tear so much, and the little one will say, I don't know why I'm crying, but I am. And the tears will be there, but he isn't crying. I had one doctor, I think it was in last night's class or the night before, who told me about such a situation with an adult, where the lady, who was an emotional problem case, he said to begin with anyhow, he said her tears were flowing so copiously. And in the midst of it, for no reason at all, she began to cry. And I said, Doctor, she wasn't crying, really. She was crying because she wanted to agree with the tear flow, that's all. There was no real crying there. But now you've mentioned several signs. You've mentioned the body warmth, you've mentioned the eye flutter, and you've mentioned the increased lacrimation. What else did you notice? Because there are other signs. You can always tell if you know hypnosis well by the signs, whether you have the patient hypnotized or not. And nobody need ever know that you know the signs, because you don't have to tell anybody what they are, but just watch the patient. And sometimes you'll hear a patient say, oh, I wasn't hypnotized. And you've seen all the signs of hypnosis, and you know darn well they were hypnotized. But because they expected to be hit on the head in hypnosis, and hypnosis doesn't act that way, you know you've got hypnosis, and you know you've had hypnosis, but the patient will deny it. But the man who knows his signs can never be fooled by the patient who says, I wasn't hypnotized. What other signs did you see, gentlemen? No, slow breathing could be imitated, doctor, and hypnotic signs are those which cannot be imitated, cannot be pretended. This is another sign that has to do with the eyes. Didn't any of you notice the... No, it isn't that they aren't in focus. It's another... No, you could act that out. Did you notice anything else? Didn't any of you notice the whites of the eyes getting red? Didn't any of you notice that? Usually that is such a common occurrence that at a second class you'll find doctor after doctor who has noticed the whites of the eyes getting red. I want you to notice my wife's eyes. Pauline, would you take off your glasses, please? Notice the color of the whites of the eyes now. Because while I have her do this, I'm going to show you still another sign of hypnosis. But I want you to notice afterwards the increased lacrimation, the redness of the whites of the eyes. I want you to learn to observe the signs of hypnosis. And since my wife gives off these signs so beautifully, you should be able to see them from where you're seated. All right, get eye closure, will you please? Now, test. Notice where those pupils of the eyes go, right up into the head. The pupils go up. This is a sign of hypnosis which you will observe on so many, many, many people. Yet it is not a universal sign, but wherever you do see this sign, you can almost say to yourself, that person is headed for somnambulism. See where the pupils of the eyes are, and see how those eyes are right up in the head? Now, in sleep, they say that the eyes go up into the head. In hypnosis, however, they don't seem to go up into the head with so many people. But there are sufficient number of people whose eyes do go up in the head that even if their eyes don't open a slight bit, as my wife's do when she tests them, and you can see where the eyes are, if those eyes stay closed like this, you can see by the shape of the lid and the shape of the eyeball that the pupil of the eye is up here instead of being here when they're looking straight ahead. Look for that sign, gentlemen, and you will see it on many, many, many people. Now, open your eyes, Pauline. Now, notice how the whites of the eyes get red, and notice the increased lacrimation. Can all of you see it? Is that observable as far over as you, Doctor? Can all of you see it over here? Can you all see it? Is there anyone who can't see it? Because this is very important for you to know. Starting out, you must know the signs of hypnosis. All right, now, we have mentioned in all 5 signs of hypnosis. Let's repeat them again so that you know what they are. First, body warmth. Oh, you'll see that so often. And in fact, you'll notice it with everybody. Second, fluttering of the eyelids. Third, the whites of the eyes getting red. Fourth, increased lacrimation. Fifth, eyes going up into the head. And sixth is a sign which I don't call a sign, and yet I have to agree with the textbook writers up to a certain point. For in every textbook dealing with hypnosis, you will find that these people will tell you that associated with hypnosis is a host of signs, and these signs go to spell a fear syndrome so far as I am concerned, and I am definitely certain from the work of our students that if you don't use the word hypnosis, these signs never appear. I don't think they'll ever appear if you don't use the word hypnosis. Yet every textbook will list them, and they'll tell you that the person will show faster breathing, and they'll say faster heartbeat, increased blood pressure, faster pulse, and so on at the start of hypnosis. And you'll see that in book after book. Now, up to a point, I'll agree. If you use the word hypnosis, those signs will definitely show up. Because I could go to any person in the back part of this room who hasn't been here before and say, I'm going to hypnotize you. And every one of those signs which I have now mentioned would appear in that person's body if you had the necessary testing devices. You'd find that the respiration increases, the blood pressure goes up, heartbeat is faster. You'd find all these things, but they only indicate to me that she has been frightened by the fact that I have said, I'm going to hypnotize you. Yet I have to agree that these things do show up, but they don't show up if you don't use the word hypnosis. So where you use hypnosis, you will expect to find those signs. But since many of you are dealing with cardiac patients, patients who suffer from hypertension and things like that, these signs of fear are neither desired nor wanted. And to avoid those signs, avoid the use of the word hypnosis, and you'll never see those signs, and yet you'll have your hypnosis. The patient will get the benefit of the state without the fear engendered by the word. You know the 6 signs of hypnosis now. And tonight as you work and as you practice, I want you to notice on every person that you work with that these signs are present. Satisfy yourself that these signs are present. In other words, don't satisfy yourself that you've got hypnosis until you see those signs. Because if you get in the habit, like any good operator, of just looking at the person, and a momentary glance will let you see all the necessary signs, and if you see all these necessary signs, you know the person has got it. Then proceed. And if you don't see the signs, you'll be very much like I am, or like any old student is, and you say, uh-oh, look out here, maybe we haven't got it. Either you stop or you start over. But you must see the signs of hypnosis, or else, if you don't see them, you're not satisfied. All right, now let's go on to something else. I would like to find out how successful this group has been with autosuggestion. Will you raise your hand, those who have been successful with autosuggestion during the past 2 weeks of practice, please? Well, you have, I know, partially. Who else has been successful? Only a couple of hands went up. And, gentlemen, that isn't good. Now, let's make it good. Let's make it good right now. I think the whole trouble is that many of you who succeeded the first night thought it was so easy that you didn't think it necessary to practice it. How many of you did not practice it the past 2 weeks? Will you raise your hand? Now, there's a man who's honest, but only one man didn't practice it? I wonder if the rest of you practiced it 50 times a day. You didn't practice it.
I didn't practice it. My gums is numb all the time. I couldn't get them out of there.
Oh, well, then...
My gum would get numb. I'm going to see if Elmer can't get the finger numb or something else besides my...
Oh, you could have gone any place over the human body, or any place over your body. Sure you could. The only reason I have you start with the jaw, Doctor, is this, so you'll understand why. We've all been to the dentist, and they've made our jaws numb. So naturally, we can almost, in our mind, imagine how numbness feels in our jaw just by remembering the experience in the dental office. But when you try to say, my hand's going to get numb, how many of us have had numb hands? Not very many. Or numb toes, or feet, or behinds, or fronts, or anything else. We don't know what numbness feels like in those areas. So I start teaching you, knowing that if you can get anesthesia in your jaw, you can send it to any part of your body, any place where your mind directs it once you get it. But I didn't see too many hands go up again. Let's get a count of how many were able to anesthetize themselves when they practiced. Let's find out. 1, 2, 3... Well, you were able to do it. Your hand didn't go up. Well, if it's numb, so numb that you didn't do it anymore for fear it stayed numb too long, you were certainly doing all right. So there were about 3 or 4 of you that were able to do it. That still is not good. Every man in this class should be able to anesthetize himself completely by autosuggestion. Now, yes, Doctor. Yes, you get to the point, Doctor, where you can do that. I want all of the men to get to the point where they can do that. You see, many men practice it and find it very difficult to do. Other men, like yourself, find it very simple to do. I was one of those men. It took a long time for me to get autosuggestion. I could teach it to everybody else, but, brother, I can sympathize with a man who doesn't learn autosuggestion too easy, because I didn't learn it very easy. I learned it the hard way. But I learned it as a measure of self-defense. I hate pain. I am the world's biggest sissy when it comes to pain. And when I give myself an autosuggestion and don't feel it, I have such a powerful ally that I regard autosuggestion as one of the most valuable things I have. When you get that numbness, you've got something that is priceless. I mean by that once you can give yourself anesthesia anywhere over your body, you get to the point where you can use autosuggestion for so many things. Suppose you want to memorize something, or you want to study something. Suppose you want to learn a technique. It doesn't have to be a hypnotic technique. It could be some technique in medicine that you've gone and watched some man do a particular type of surgery, we'll say, and you want to perfect that surgery in your own mind. Autosuggestion would enable you to be about 10 times more effective in the study than any other man in the room who didn't use autosuggestion. You will find this, that in the theater we have many men who have played stock, and they have taken a part consisting of 127 sides and have memorized it overnight. Now, you can't memorize 127 pages overnight unless you give yourself an autosuggestion. You couldn't possibly do it. These people are using autosuggestion, but the man who can use autosuggestion can use it to memorize 127 sides in a night, or he can use it to anesthetize himself, or he can use it to give himself pep when he's tired out, or to give himself sleep when he's tired out, depending on what he wants. He can use it in every conceivable direction. I don't think the day goes by but what I use autosuggestion about 15 or 20 times. For example, one of the wonderful things it'll do, it'll enable you to hold your temper. I used to be one of the shortest-tempered people in the world. I didn't have patience for anything. And I learned through autosuggestion to control my temper. I've learned how to give myself anesthesia. I've learned so many different ways to use autosuggestion. You can use it the same way if you just decide to learn it. Now, I'm not satisfied that 3 or 4 of you were able to get anesthesia. Every man in this room, every woman in this room, as far as that goes, should be able to get anesthesia. Let's try it, and let's see if we can't all get it the first time. Now, here's what stops most people from getting it. They try too hard. Don't you try too hard. In other words, say to yourself, the other people get it, I can get it. The other people are studying the same course, I'm studying the same course as the same teacher. And if he can teach them how to give themselves a suggestion, he can teach me to give myself a suggestion. I'm going to make it work. But don't say to yourself, I've got to make this work, I've got to make this work. I think that that's what keeps a man from learning autosuggestion. He tries too hard. And when he tries too hard, he fails utterly. So just say to yourself, this would be a nice thing to have. I would like this. And you'd be surprised how fast it will come. I'm not going to try the stiff finger first. I'm going to see how many get anesthesia the first time through. Then I'll try that rigid finger thing. Let's say the first word and lock our eyes. Say the word green and lock your eyes. Green. Now, lock your eyes. Make sure that they won't open until you have said that word 3 times. Now, stroke your jaw. This is the area that you want to anesthetize. Now then, say that second word with this thought, that you're going to imagine for a couple of seconds that anesthesia is coming in there. If you want to pretend that anesthesia is coming in there, imagine that anesthesia is coming in there. And in about 2 seconds, you can stop pretending and you can stop imagining, because the anesthesia will come in, and then you can watch it get more powerful so that by the time you open your eyes, it will be complete. Say the second word and imagine that anesthesia is coming in, and you'll find it'll come in. Green. Now, feel it come in. Just imagine it coming in. Now you can stop imagining, because it'll continue of its own. Nature will follow its own devices now to bring you a complete anesthesia. Now it's going to get more powerful and more powerful and more powerful, so that when you open your eyes, it will be complete and entire. Just want that to happen. Expect it to happen. And now watch it happen. Say that third word and you'll have it. Green. Now open your eyes, and how many people have it? Yes, notice the number. 1, 2, you got 3, 4, 5, 6, 7, 8. And you got it over here, did you? Did I see a hand go up over here? Oh, it was just your hand to your face. Hey, you got it. Now, I bet you surprised the devil out of you, didn't it? Sure. But 8 people got it. That's quite a little bit different than 3 or 4 people. Let's see if we can't make it complete now. Say that word and lock your eyes. Green. Now, stroke your jaw. Everybody wants it this time. You want complete anesthesia in that jaw. Now imagine that anesthesia is coming in as you say that second word. Green. Now, just imagine for a couple of seconds, and now you can stop imagining, because it'll carry on the rest of the way by itself. Now, let it come on full force as you say that third word and open your eyes, and every person in the room will have it. Now, say that third word and you'll have it. Green. Now how many have got it? Raise your hands, will you? All right, we got 1, 2, 3, 4, 5. Have you got it? 6, 7. You're not getting it? Are you 8? 8 and 9. Have you got it yet? Have you got it yet? 9, 10. Did I count the ones on this side? 11. I don't know if I did or not. Well, do that again. Raise your hands, those who got it this time, because I don't think I count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That's all that got it on this side. There's still some of you missing. This side is doing a lot better than this side. There's no reason why everyone on this side shouldn't have it. Let's see if we can't all have it this time. I'm just going to practice it this once, and let's see if we can't, every one of us, have it. Now, let's just take just a minute to get the rigid finger, because here's something else you can practice that'll give you something else to do as you practice autosuggestion for the next couple of weeks. Decide that you want to have a rigid finger. Now, to some of you, the rigid finger will seem kind of silly. Don't let it seem silly. Remember that if you can give yourself one suggestion, you can give yourself another kind of suggestion. So all I'm trying to do is to give you a suggestion by which you can prove that you've got autosuggestion mastered. The idea is that you want that finger to be so rigid that after you open your eyes, you're going to try to change your mind about it. You're going to try to bend it by actually changing your mind. And despite the fact that you're going to try to change your mind, you'll find that you cannot change it and the finger won't bend even if you do change your mind. That's what I want to have happen, and then you'll see that a rigid finger is not quite as silly as it sounds. I'll show you how effective it can be. Say the first word and lock your eyes. Green. Now, make your forefinger absolutely rigid, so rigid that you can't bend it. Now, say that second word with the idea that it's going to be so rigid you can't bend it. Green. Now, try to bend it, and you'll find you can't bend it, no matter how hard you try. Now, you want that finger to be so rigid after you open your eyes that even if you try to change your mind, you can't bend that finger. So say the third word, open your eyes, and you'll have a rigid finger, and you'll find you can't change your mind. Green. Now, try to bend your finger. You'll find you can try to change your mind, try to do anything you want. That finger won't bend. See what I mean? You've got it. Now, if you've got it and you can't bend it, no matter if you try to change your mind or not, then you've got it. Now then, those of us who've got it, let's say the first word and lock our eyes and reverse the suggestion. Green. Green. Now the little finger will start bending. Green, and now it'll bend. Now, how many of you got that rigid finger just as I described it? Now, notice that. You see the number of hands go up. And now, all of a sudden, a rigid finger doesn't seem so silly when you find that you can lock your mind around an idea to such an extent that you can't even change your mind about it. That will let you see how effective hypnotic anesthesia is. Because once you get it, you won't let it go. It's just like the rigid finger. You won't let it go. Now, we'll try the rigid finger once again, and then we'll go for anesthesia. And I think everybody in this room will then be able to get the anesthesia. Let's try the rigid finger again. Say the word green, lock your eyes. Green. Now make your finger rigid. Now you want that finger so rigid that when you say this word the second time, you won't be able to bend it. Say the word, green. Now try to bend the finger, and you can't. Now, say the third word with the idea that you won't even be able to bend it after you open your eyes. Green. Now open your eyes, and you can't bend your finger. Now you've got it. Now then, try to bend it. Try to bend it, and if that finger won't bend, you've given yourself a solid autosuggestion. Now, you want to reverse it? Say the word green, lock your eyes. Green. Now say the second word, that finger will bend. Green. Say the third word, it'll bend completely. Green. Now let's try anesthesia, and let's see if everybody in the room can't get it. Say the first word, lock your eyes. Green. Now, stroke the area you want to anesthetize. Now say that second word and imagine the anesthesia is coming in, and you'll feel it come in. Green. Now feel it come in. Imagine you can feel it coming in. Now you can stop imagining, and nature will carry on the rest of the way herself. Now you want that anesthesia complete when you open your eyes. Say the third word, open your eyes, and you'll all have anesthesia. Green. Now open your eyes, and you'll have it. Now I'd like to count the number of people on this side who have it. Raise your hand. 1, 2, that's the first time you got it, right? 3, that's right. 4 got it on this side. Now let's see how many on this side.